Hi everyone, my name is Neve and I'm a fourth year dentistry student, so I'm just here to talk about the School of Dental Science that's here in Trinity College. Okay, so in the dental hospital, there's 4 different courses run. So we have a diploma in dental nursing, a diploma in dental hygiene, a degree in dental technology, and then a degree in dental science. Okay, it's all based here on campus at Lincoln Place, so it's hard to miss. It's right at the back of campus, big red brick building. We have state-of-the-art facilities. You can see here this one of our lecture theatres there. The picture's now showing our undergraduate training lab. We learn everything on mannequin heads here before they let us loose up in the clinics. So then we have 3 dental clinics. Every student gets 1 dental chair. So we don't partner up for sessions, it's all on your own, and we get the most clinical exposure nationally. Also within the hospital we have a day theatre. We also have an oral surgery, oral medicine department, and there's also radiography. CSSD is where all our equipment gets sterilised. So it's the National Centre for all dental specialities, internationally recognised research active staff directing, involved in all students' teaching, and there's also opportunities for students to engage in research. A lot of students undertake that every year and continue on into specialist training. We have a library also in the dental hospital. You can see there it's brand new, it was only opened about 3 or 4 years ago. Also computer facilities on site. There's a common room in the dental hospital as well, where both staff and students can have lunch every day, so it's good to have. It's a very nice place. Architecturally, it's really nice. It's quite new as well. It's a lovely place to be in. I'm just going to hand you over to one of the girls here to talk to you about the diploma in dental nursing.
My name's Sarah Conley. I'm a second year dental nurse, and this is Yulia. She's a first year dental nurse. Your diploma in dental nursing, it's a 2-year full-time course. It's continuous assessment throughout the year. You get assessed on clinics, how you work with other staff members. You'll have lectures as well as clinical time. You have tutorials in the training lab with the dental hygiene and some of the dental science students as well. And you have practicals such as mixing materials or knowing your instruments as well. And you'll have seminars in the lecture theatres with other years. And you have clinical placements outside of the hospital as well as inside the hospital, such as James's, Vincent's, and you'll go out to a general practice as well. There's a variety of clinical placements. You go to the day theatre in the hospital, you'll have clinics, there's an A&E, an oral surgery department, and you'll learn in CSSD how to process instruments to make them sterile for other use. And you'll go out to, as I said, a general dental practice out somewhere else to work to get exposure for a month. And you'll do a week in a HSC practice somewhere in the country as well. And you work in St. James's. There's an orthodontic clinic and there's a haemophiliac clinic out in James's, and St. Vincent's is a latex-free clinic. There's integrated teaching. You'll have classes with dental hygiene students, dental technology and dental science. You'll have shared classes with dental hygiene, and you're part of a dental team. You're not on your own. You'll have a clinic nurse manager who'll look after you for your 2 years. You'll be assigned a nurse, 3 students per senior nurse, so you'll be assigned a nurse and she'll look after you for the year. You get practice management, marketing and you have a dental nurse tutor who's Helen Farley and Karen Deneen. They're your main tutors for the year. They're the heads of the course, and you have lecturers who are other clinicians in the college. I'll hand you over to Barry for the dental hygiene.
So hello, my name is Barry. I'm doing dental hygiene. So essentially it's a 2-year full-time program, so you're in pretty much all the time over a space of 2 years. So it's under continuous assessment, so you're in college all the time, you're studying most of the time. So we have a lot of tutorials and practicals and that sort of stuff in first year, and then once you progress into second year, it's basically you're working as a hygienist would. Just you have a few exams to do, a bit more specification and all that. So in first year we have integrated teaching, so we do a bit with clinical dental science students, some with nurses, some with dentists, some with technologists. It's just in first year. It's just a basic overview, so you know exactly who's on your team, what you're doing with them, and all that. So here, I think there's a picture of someone just brushing a dinosaur's tooth or something like that. So essentially, one of the main things is to promote oral health to pretty much everyone that we meet. So that's essentially the basic thing we do. The other thing is just scaling teeth, scale and polish. I'm sure most of you already know. So also as part of the course, we do oral health presentations, community projects, and all that sort of stuff, where we sort of go into the community, and we've different, as a part of our exam, we do different presentations to different groups. It's just another part that we do, like, essentially when you can assess a big group rather than patient by patient basis, it's better overall. So career prospects, researcher, there wouldn't be that many jobs for it, but for some people, like, you can get into it, it's doable. A lecturer, again, there's not that many jobs. Like, basically most people who come out will be actually working as a hygienist. There's a few jobs for lecturers, but that's, I suppose, be really for people who are like from Dublin and it'd be easy to access the dental hospital and all that. Corporate educator, sales rep, there's a lot of work to be got for sales representatives. Basically, like, I'm sure you all know all the promotions that like Colgate and all them different dental things have on. So there's some jobs for that. Some of them are dental like related. Other people who'll be in it wouldn't have anything but marketing and sales as their background. Okay, so I'm going to pass you over to Neve for dental technology.
Okay, I myself, I'm doing dental technology, but I'll talk you through it as best I can. So there's a degree in dental technology in the hospital. Basically, our technologists are really the backbone of dentistry. So it's a 3-year full-time program. It's very much hands-on experience. So if you are a creative person, very good manual dexterity, it's definitely the course for you. Use of CAD and CAM, so this is just computer-aided technology that we use now for making crowns and bridges and that kind of thing. Also Erasmus exchange opportunities. Erasmus is an opportunity when you're in college that you can go for a semester or 2 semesters to another college, either be in Europe or further abroad, and there are students that undertake that. Are you good with your hands? We want you. So as I said, if you're a very creative person, kind of an artistic side, it's definitely that type of course. Working with various different materials in just the fabrication process. Because when you go to the dentist and you get your crown or your bridge, this is where it comes from. Someone that's very specialised. Again, integrated teaching. Myself in dental science, we would be in a lot of classes with dental technicians, and they try and integrate us as best they can, so to kind of mirror what happens in the real world. Working with dental students, making bridges, crowns and appliances for patients. I know myself, when I'm in clinics, we make sure to bring the dental technology students up to help us, again, as what I said, to mirror what happens in real life. You really, as a dentist, you rely on your dental technologist. Shared classes with dental science, and it's an integrated part of the dental team, as with the dental nursing and dental hygiene. Making crowns, bridges, dentures, also orthodontic appliances, your retainers, your space maintainers and implants. Based in the lab most of the time. You can be self-employed. You can work to the prescription of a dentist, and you can be directly involved with the chairside delivery of your work to patients. So, there's a lot to it. You're in the lab, but you get, more and more dental technologists are being brought in to view patients, and it's not seen as a separate entity altogether. Career opportunities, again, self-employed, it's a job that you can bring anywhere in the world with you. Postgraduate opportunities. Now I'll just lead you on to the degree in dental science that I myself am doing. It's a 5-year course, and I'm in year 4 of it at the moment. Basically, from second year on, you get the opportunity to work with your own patients. A lot of people don't believe you when you say you have your own patient list, but from second year on, you do get your own patients, and you are fully in charge of them, and you are, it's your responsibility to take care of all of their care, compared to other colleges where you mightn't get that till maybe a couple of years on. It's one of the benefits of training in Trinity. By the time you get to 5th year, you'll have completed most of the treatments that a dentist will carry out. As I said, I'm in 4th year, and I'm carrying out everything from fillings to dentures to even now implants are being placed, and as a student you'll get to restore implants. So it's, as a trainee, you're getting to lead the dental team. So we have our dental nurses, dental hygiene, and dental technologists, and we're leading the team, delivering oral healthcare treatments. And in Trinity, there is the opportunity for specialising in different areas. As you can see here, here's our undergraduate training lab. You have a mixture of lectures and small group teaching. Practical lab sessions, everything that we do on clinic, you will do down in a lab situation, first of all. Continually assessed every day. It's not just based on exams. Yes, you do have exams, but every day you're being constantly assessed on different things, whether it be practically or theoretically. Presentations, we get many of them every year. Also research opportunities in all years, and in 5th year you have a thesis to do, but every year there are opportunities to do research if you're interested in that. So integrated teaching, you've shared anatomy, physics and chemistry classes in year 1. So in year 1 you do anatomy, and you'll do it with other disciplines, so medical students or radiography students, physiotherapy students. Then share teaching with dental nurses and dental hygienists. Yeah, we would have similar lectures a lot of the time, and working with dental technology students on patient cases. So as I said, you bring your technologist along whenever you can to help you along with your case. Erasmus opportunities in Norway, Sweden and UK. When you go into 4th year, there is the opportunity to go away for a semester. I know there's a girl in my own year going to Sweden now, and you get to go over and see what it's like to study dentistry over there. Also in 4th year you get to do the opportunity to do an elective. Last year students went to Cambodia, Brazil, Honduras and different places like that. You basically have the opportunity to go anywhere and try out your dental skills somewhere else. So why study dentistry in Trinity? Basically, we have really high achieving students. Every year there's scholarship winners. I know my own year, 5 students got the prestigious scholarship award that Trinity give out every year, which was a huge thing. Within dentistry, we've very talented people. So sporting achievements nationally and internationally. Also academic achievements and awards. You really have kind of the top end of students. Just with studying in Trinity, there's loads of postgraduate opportunities once you finish. So after 5 years, if you feel like you want to do a bit more, you can go off, and there's so many different areas within dentistry to study. So oral surgery, orthodontics, pediatrics, prosthodontics, periodontology, special care. Each one of those you can specialise in. So basically there's a tour, if you're interested, there's a tour of the dental hospital at 2 p.m. today, and you can sign up at the information stand. Where is
It's upstairs on level 2.
Okay, so, and if you want to ask any of us any questions afterwards about any of the disciplines, whether it be dental hygiene, dental technology, dental science, just come up to any of us and any question at all. All right, thanks very much.